Diabetes is an illness in which the body is unable to regulate the amount of sugar in blood. The two most common causes of this would be: one, you are unable to produce enough insulin from your pancreas, which is what we call type 1 diabetes, or two, you produce the insulin but are unable to utilize it in the body's cells, what we commonly call type 2 diabetes. My name is Dr. Amanda Ngolobe. I am a consultant physician and endocrine and diabetes specialist at the Moi Kibaki Referral Hospital, the level 6 facility in Othaya. So what are the risk factors for developing diabetes? In type 1 diabetes, it is hereditary, so it is one of those conditions where you find that in the family, there are patients who have had diabetes at a young age. Second thing, there are certain viral infections that can give you diabetes. Third would be certain illnesses like pancreatitis that can also lead you to getting what we call insulin deficiency. When we come to type 2 diabetes, we have a bigger risk factor profile, chief among them being lifestyle changes that are detrimental to the body's health. So obesity, very big on that list. Our diet is also very big towards directing us towards type 2 diabetes. You have certain conditions that give you a higher risk of developing type 2 diabetes. Any chronic condition can also increase that risk. You have certain medications. Patients who are on steroids for a long time have a higher risk of developing diabetes. What are the signs and symptoms that would make you go to hospital to get checked for diabetes? The most common one is excessive thirst, which is followed by excessive urination. Next to that, you have wounds that don't heal very quickly. They take a longer time to heal than usual. You have certain complications of diabetes that can present themselves initially for you to think you have diabetes. So nerve damage, especially to your fingers and your toes, where you get numbness or you get a sensation of heat. Sometimes there are patients who present already with damage to their other organs, mostly the kidneys, giving us what we call chronic kidney disease. Some of these effects of diabetes on the body are the reason why we insist on controlling sugars very well, because we tend to be able to prevent certain diseases. Chronic kidney disease is one of them. Heart disease is another. Diseases like stroke are also big on the list for why we want to control our sugars, especially if you're known to be diabetic. I would like to invite you to come to the medical camp that is going to be held on the 19th of November 2025 at the Moi Kibaki Referral Hospital. We are trying to celebrate the World Diabetes Month, in which the theme is to know more and do more for diabetes in the workplace. We would like to give you the information that you would need to be able to prevent diabetes if you are at high risk of diabetes. We'd like to give you the information you need to manage diabetes if you already have it, the nutritional information, the information on exercise and movement. For patients who already have diabetes, we have many health professionals who would be able to guide you on the medications you can take. We have health professionals to do dental screening and ophthalmic screening for eye tests and to look at your teeth. We also have medications that we will be able to give out to the patients who come and are in need of them. Our objective is to try and educate the population in the Mount Kenya region, which is one of the regions with the highest prevalence of diabetes, on how we can prevent this disease and how we can be able to control it. I hope to see you there. I hope that you will take control of your health and take control of your future. Thank you.